everybody watching. My name is Christina Herrin, Government Relations Manager of Health Policy at the Heartland Institute. Thanks for listening to our podcast or video interview today. Today we have Bethany Marcum of the Alaska Policy Forum to talk a little bit about healthcare in the state of Alaska. So Bethany, thank you so much for hopping on here and talking with me today.
Thanks. Good to be with you and your listeners.
Yeah, absolutely. I really do appreciate it. And I know that there's a lot going on in the Alaska legislature, especially in regard to healthcare policy. I first want to just start off by talking about certificate of need law. And I know that there is a bill. And what, exactly can you tell us about the legislation or certificate of need law in general? For those of our listeners who don't know what con law is, Bethany, can you give us a little bit of a breakdown on that?
Sure. Certificate of need, or CON, as it's typically referred to, is really a permission slip from the government for various healthcare kind of facilities and providers to be able to provide, to put together a facility or to provide some sort of service. For example, if you wanted to be able to create an imaging facility to do X-rays and MRIs and that sort of thing, you can't just open that up because you think there is a need for that, or because you think that the current imaging facilities in your area are not doing a good job or charging too much. You can't just do that in most states. You have to get a permission slip from the government first to do that, which is rather absurd when you think about that in comparison to other industries. If you wanted to open a store or even a dental practice, you could just do that, right? And but there are certain medical sorts of services that are covered under these certificates of need. And they basically have to get a permission slip. You have to go through a very expensive process, applying through and time-consuming process with the state government, applying for this permission slip, this certificate that allows you to then open up your business. And by that time, you've already dumped a huge amount of money in just the application process, let alone the investment in your business. And so it reduces barriers to entry, which of course means that there are fewer providers, fewer facilities for some of these services. And of course, that drives up costs. And so we care very much at Alaska Policy Forum about the healthcare costs that consumers have to pay. And so this is a particular policy that we've been working on for quite some time. And it's of note that during the pandemic, they felt the need to suspend at least one of the certificates of need because they realized that they might need more facilities, more beds, more services than what they would be able to ramp up during the pandemic. And so, we maintain that if there is a need to do that sort of thing during the pandemic, then we need that flexibility all the time in our state. And so we've always been strong proponents of getting rid of certificates of need. The federal government said a long time ago that states should do that. Some states have taken that advice to heart, but we have not yet in Alaska.
Right. Yeah, I think that's a really good point, too. You mentioned costs. I think a lot of supporters of con laws have this idea that somehow it's, helping low income people get access. And the reality is states with con law on the books are, more costly. And like you mentioned, they stifle innovation. And, that's a huge, link to cronyism. And it's just really unfortunate that these barriers are in the way from new startups and new technological advancements and, creating more facilities that would actually, like you mentioned, would lower costs for patients. So, I agree with everything you said. And, just I'm really happy that the Alaska Policy Forum is, engaging on this. And then also, I just do want to reiterate the fact that you mentioned, 24 plus states had suspended con laws during, the COVID or the height of the COVID-19 pandemic. And, Alaska was one of those states that did, suspend at least one program. And so that really does beg the question here. During the height of, the greatest, healthcare crisis in our lives, if con laws are, unnecessary and burdensome, how is it not the case that not during pandemic times that those laws are, outdated and unnecessary? So I think that's a really good question. We need to ask our legislators, and, I'm glad that Alaska Policy Forum's engaging on this. So, do you have any thoughts about the legislation itself, or, what are other folks in the state saying or thinking about, the legislation, or is there any other thoughts you have on con in the state?
Yeah, it's interesting because repealing certificate of need has been introduced in Alaska as legislation for goodness, at least the last 6, maybe 8 or so years. And, usually there's a hearing or two, but then that's just kind of been the end of the discussion. And, that goes to the cronyism that you mentioned, Christina, which is there are organizations, there are facilities, there are providers, there are business people that already have their facility and their organization. And what listeners may not know is that those are the people that get to help weigh in on and decide whether or not new competitors come into the market. And so you can imagine that's a very powerful special interest to fight against. So even though these bills have been introduced in the past, there are so many current providers of these facilities and services that they speak up and legislators back down and it never goes anywhere. Well, the pandemic really did kind of open the door this year for people to understand that this is something that we need more flexibility with. And so this year, Senate Bill 26 was introduced. I think it's identical to some of the bills that have been introduced in the past, but it does have a hearing scheduled for next week. And so we're very excited about that because we think that there is new interest in these discussions now that people recognize through the pandemic that the state needs the flexibility to be able to have facilities to be able to accommodate that which the market demands.
Right. Yeah, that's all great. And I'm just loving this because it's just so true that I think governments often think they can centrally plan things. And it's like healthcare. I mean, you see COVID and there were, ventilators needed and beds and things like that. Healthcare is so unpredictable and is completely transformative. It's always changing and progressing and, new technologies are coming about. It's insanity to me that the government thinks they can predict or determine need because we know as free market people that only the market can determine that need.
That's right.
And the businesses or the healthcare facilities and the industry is going to react to that need because they want to make, a profit and they're going to provide for the consumer, which are the patients.
Provide a good service. Uh-huh.
Yeah, it's just a huge barrier, to that free exchange of services and goods. And I just think the cronyism that you mentioned as well is, such an issue that we need to hit on, that there are players in the market who want to often keep the little guy out and they want to keep this regulatory capture issue almost, where they want to use these regulations to their advantage. And it's just, cronyism is like icky to me. I just think it's, the worst thing. And it just makes my blood boil. So I'm really glad that y'all are addressing that.
If you think you're providing a good service or product, you shouldn't be worried about others in the market coming in because all that does is keep you on your toes and keep you providing a better product and service, right? So, but so often people want their little fiefdoms to be protected.
Right. Yeah. It's unfortunate. So I really hope Alaska, is able to do the right thing here. And you said 6, 7, 8 years this has been bouncing around the legislature. So hopefully, they're able to make some decisions that are, supporting, patient-centered, focused decisions. So
we've been doing some work on this for a while. We had a very extensive healthcare cost report that we put out last year. We hired a nationally respected healthcare economist to do a very extensive deep dive into the cost of healthcare in Alaska and help us determine what are some of the things that we could change in statute and regulation to help drive down the cost. And certificate of need is one of those things was identified. And so that's available on our website. And then we also did a special policy brief and we've testified. And we're going to continue to push this issue because we think it's important for Alaska healthcare consumers to have access to the sorts of facilities and providers that are willing to step out there and do that, not just those that get permission from the current players. Right.
That's awesome. And you mentioned, we've mentioned the con law policy, but are there any other policies that you all are engaged on, that are, current and, that the Alaska legislature could, work with you on?
Yeah, absolutely. So another one that we're working on right now is extending telehealth licensing for providers who have licenses in good standing from out of state. So we have many medically underserved areas in the state of Alaska. We have a shortage of primary care as well as other provider areas. And it's a challenge sometimes to find or to get an appointment with, a provider. And one of the ways that we can expand the pool of providers is by letting the ones who are in state concentrate on kind of some of the higher level sorts of services and let telehealth take care of many of the lower level services. We actually have a very robust telehealth in terms of the actual medical practice of telehealth in Alaska. We were one of the innovators in the 1970s. Alaska moved into the telehealth industry, if you can believe it. Wow. Of course, back then it was just by by telephone. It was really tele at the time, right? But now it's very extensive virtual sorts of things. But we have a very robust laws regarding telehealth, and it's used very extensively, partly because of the remote geographic portions of the state that we have. But what we don't do is allow someone who has a license in good standing from another state to provide telehealth services in Alaska. The doctor, the nurse has to jump through all of the licensing hoops and pay all the fees and so on in order to be able to get an Alaska license before they can provide just telehealth. And I always use the example, if you were to be in a car accident or something in Arizona, you're not going to be worried about the doctor that treats you at the hospital there in Arizona, whether or not they're a good doctor. You're going to trust that they're a good doctor. So why do you trust them any less if they want to call in and provide telehealth to you when you're in Alaska? Consumers don't see it that way, but of course, some in the medical industry are concerned, and they have some legitimate concerns. They have spent money to create their offices and to have equipment and such there, but many of those sorts of services are not the sorts of services that are going to be provided by telehealth anyway. So really, when you talk about telehealth, there's just kind of limited to what you can do, right? So I give examples of things like pink eye, is one of the sorts of things that can be done via diagnosed pretty easily by telehealth. And it's contagious, right? So isn't it better to get on the phone with somebody via telehealth and have that diagnosed and have them come in and sit in a waiting room in a doctor's office somewhere? So, we can expand that pool by letting those providers from out of state be part of that pool.
Yeah, it sounds like a reciprocity issue. And I think a lot of times when people, are in opposition of any telehealth expansion, a lot of folks think that it's instead of, in care or in visiting a physician, in person, and it's instead of, and really it's in addition to, and, this is just an alternative way. It's not replacing something that already exists. It's just expanding access for patients, like you said, that just can't drive, that far or have different schedules.
Contagious
why not allow people to utilize technology? I mean, we have this great thing called a cell phone. Let's let people, utilize it for care, especially like you mentioned, there's now direct primary care, and we could probably talk about that too. But, there's a lot of primary care, physicians, there's less than there used to be, and people aren't seeking, primary care as much as they should. So there's a lot of preventative medicine that could be, accessible that isn't. So I just think promoting telehealth is so important, and all of this really, is encompassed together, and it comes back to, health freedom and, patient-centered care, and that's really
access and cost. Yeah, for sure.
Yeah.
And direct primary care, that's something we are very interested in as well. We've had bills introduced in the past. The last legislative session had one. There's one that I think is probably going to be introduced this year. Still working on that. It's not introduced yet, but it's it's being looked at by legal. But it's something we've been and it's one of those ones that's been introduced year after year, which is a little odd considering the fact that we have so few primary care providers. We have so many medically underserved areas. We need to expand access, and direct primary care DPC is one of the ways we can do that. And I think we should take it further than just primary care and just make direct care allowed for specialties as well. Do most of your listeners, are they familiar with what direct primary care is, or should we talk about that a little bit? Or
if you want to elaborate on how direct primary care is an alternative to insurance, I think our listeners would really like to learn about that. I haven't done a podcast or a video, I don't think, on direct primary care yet.
I'm a big fan of it. I actually use DPC myself. But it is usually recommended that someone have like a major medical or catastrophic health care, health insurance plan as well for, accidents and the big rocks that, you get in the, hospital or something like that. Right. But for just your regular kind of maintenance, you think about car insurance, right? And when you have car insurance, that it doesn't pay for your oil changes, right? And so, but nowadays people expect their health insurance to pay for their oil changes, for other little things. And so DPC kind of fills that niche there. And it's basically, you think of it as a gym membership. It's a monthly fee that you pay to a medical provider for most of your basic medical services. And in the past, people thought of this and heard of a concierge medicine, but concierge medicine was a somewhat different level because concierge medicine doctors charged a very high fee because they also billed insurance. But the difference with your direct primary care DPC doctors is that they don't bill insurance. And therefore they can eliminate all of the administrative costs and headache and overhead of having to do the insurance billing. I think there was a Heritage Foundation study that was done that showed that 60% of the costs that medical providers incur are related to the administrative overhead, not actually practicing medicine. And so imagine if they eliminate that by just billing the patient directly for a reasonable, say, $75 a month fee, then suddenly they get to practice medicine. They don't have to spend their time, doing insurance billing, and you get much more personal care from your provider. So I'm a big fan.
Yeah, I'm a fan too. And I just love the concept. I mean, let's get, teachers back to teaching, doctors back to doctoring. Let's get rid of all these middlemen that really are unnecessary. And I think the concept is great. And I'm here in Iowa, and we have direct primary care on the books. So this is one time having something on the books is beneficial to free market people, because it, defines direct primary care is different from health insurance. So for those out there, we are talking about legislation on the books is actually a good thing in this situation. And, there's expansion of DPC happening in a lot of the states. And I think it's a great alternative, and, it gives, people a lower cost option. So why not be supportive of that? So I think that's awesome. And, are there any other thoughts you have about any other issues that the Alaska Policy Forum is engaging on? It doesn't have to be just healthcare, but maybe any other things you all have on your plate. Let's stick to healthcare for the purpose of this, because it's a really important issue. We have one of the most expensive healthcare systems in the country. Alaska does. Our costs are extremely high, and there is some rationale for a slightly higher cost because we're obviously more remote geographically, and there are some challenges there. But for the degree to which our costs are higher, there really is no justification, in my opinion, other than some of these regulations and laws that are in place that drive up the costs. We have something called the 80th percentile rule too, which is really kind of this esoteric thing that most people don't understand, and it is complicated, but it's tied. It has to do with surprise billing or balance billing, if you've heard. So there's quite a few different things like this that we could do to change the landscape of healthcare costs in Alaska, as well as improving access. And both of those are issues for us. Right.
Come together to identify and move forward with some of these reforms.
Great. Well, for our audience and our listeners, what's the best way for people to kind of stay in touch with what you all are doing?
Sure. So our website is alaskapolicyforum.org. And we're also on Facebook as Alaska Policy Forum. And then we have a Twitter account as well. You're welcome to follow us there. And that's AK Policy Forum, AK for Alaska.
Okay, awesome. Well, Bethany, if you don't have any other final thoughts for our audience, I just want to thank you, for your time and, everything you had to say here today is really good information. Well,
Christina, I appreciate the work that Heartland does, that folks like you do, and being able to partner with you on some of these important issues. So thanks for the opportunity.
Yeah, thank you so much.
All right, take care.